Good morning, folks, and welcome back to Fresh. I'm Julie DiLorenzo, your host for this segment. And our segment this morning is on health and wellness. We're going to talk about ACL injuries in particular. We're here at Osmc with Dr. Stevenson, and we're going to talk to him about the ACL injuries. But we're also here with Marla Miller, who, of course, is with the Elkhart County Living magazine, which is in part one of my sponsors for this segment, and we appreciate that. Marla, what's happening with the magazine? I know we've done a lot of stuff this winter with the magazine. Let's talk a little bit about that.
We have covered just about everything that's in the magazine on this show, but what I want the viewers to understand is Elkhart County Living is a lifestyle magazine that's about people, places, things, events, anything that has to do with Elkhart County or within a day's drive of Elkhart County. This magazine has been educating, enlightening, and entertaining people for a year now, and it just keeps growing. So I want everyone to be sure that they at least go on the website and check us out, and then pick up a magazine or become a subscriber, because you're going to be very happy with it.
We're going to talk to Dr. Stevenson about ACL, and I don't really know what ACL stands for. What would that stand for?
ACL stands for anterior cruciate ligament. It's one of the four major stabilizing ligaments for the knee joint. It's one of the two that actually crisscrosses, and that's why it's called a cruciate ligament, actually in the center part of the knee. And the other two ligaments are the medial collateral ligament and your lateral collateral ligament, all to stabilize the knee joint.
I know we have a great graphic here behind us. When someone injures their ACL, exactly, I don't know if you can show us by the graph, what is happening to your knee?
Well, most commonly it's a planning of the foot and a twisting in a certain direction, or a pivoting injury, sometimes during jumping or landing, in such sports as football, basketball, or soccer, and a lot of times even in skiers, just because of the boots coming up higher, more stress is placed on the knee. And this ligament right here, your ACL, which stops the knee from translating forward but also from rotating, sometimes ruptures and pulls apart, kind of like pulling a rope apart.
What about people who maybe also, unfortunately, have incurred maybe some weight issues? Is that really hard on the knee and maybe affects the ACL?
It can. You know, usually the patients, as they become heavier, tend to lead a little bit more sedentary lifestyle, so that the two tend not to kind of go hand in hand, but it does put more stress on your knee, definitely.
Well, here I know at Osmc, not only do you have the doctor's side, is what I would call it, where you would see the patients, but you have a great therapy side of the building. So it's a great place, folks, if you need to come in and you have some aches and pains, and really just to come in and have you check them out, because they might have something going on that they aren't aware of. But check Dr. Stevenson out here at Osmc, or give them a call. And if you need to have something checked out and you want to feel a little better, have a better lifestyle, be a little more active. Stay tuned, folks. We'll be back in a moment after this message.